Hello, all. I hope you are entering this year with renewed energy. I'm Beth Jarosz, Vice President of the Association of Public Data Users, and I want to welcome you to this rapid response data briefing on the Pregnancy Risk Assessment Monitoring System, affectionately known as PRAMS, co-hosted by Data Index, the Association of Public Data Users, Population Reference Bureau, the March of Dimes, and the Population Association of America. Just reading that list gives you a sense of how important PRAMS is. And as I mentioned, seeing so many people register for this also brings me great joy that there's so much care and attention that's given to this important data set. This rapid response series started given the pace of changes in data across the federal government. We created the briefing series to raise awareness about the potential risks to public data and, most importantly, how you can take action. We'll be sharing some specific actions today, and after the webinar, we'll follow up by email with the recording, slides, and links shared. We have just 30 minutes together today, but if you have questions, please put those in the Q&A box. If we have time left at the end, after our panelists have spoken, we'll try to answer a question or two. If we don't have time for questions, we will include as many answers as we can in our follow-up email. And today we have an all-star panel. Each of our panelists holds multiple distinguished roles, but since we have just 30 minutes together, I'm going to highlight just one role for each of them. Dr. Rita Hamad is Professor of Social Epidemiology and Public Policy at the Harvard School of Public Health. Dr. Michael Warren is Chief Medical and Health Officer at the March of Dimes. Denice Ross is former Chief Data Scientist. And Meghan Maury is former Senior Advisor for Data Policy at the White House Office of Science and Technology Policy. And together, they will walk us through what's in PRAMS, why PRAMS is important, the risks facing its continued collection and publication, and how you can help support this essential data resource. So to kick us off, Dr. Hamad, I'm going to start with you. Given your expertise in using PRAMS to understand the perinatal health effects of social policies, can you give us an overview of what's in PRAMS?
Yeah, thank you for that introduction. I'm really excited to be a part of this data briefing. PRAMS is such a unique and critical national data set that I use a lot in my own work, and that's so valuable for practitioners and policymakers, as we'll hear from the other panelists. For those who are less familiar with PRAMS, I'm going to give just a high-level overview of this data set. So in terms of who it covers, PRAMS covers postpartum people. About 1,000 to 3,000 are surveyed in each state in each year. So that's tens of thousands of observations in a given year. It is a population-based surveillance system. It's intended to be representative at the state and national levels. It includes a very rich survey that captures maternal behaviors, maternal experiences, both before, during, and shortly after pregnancy. The data are usually collected about 2 to 6 months after birth through surveys. And the data are linked, the survey data are linked with administrative data that are drawn from birth certificates. So it's this really, again, unique combination that gives us a lot of deep understanding of the perinatal period. In terms of what's in the survey, there are core questions that are gathered by all states. And then each state can also add its own questions to fit their local context, their local needs. As I mentioned, the data are collected at the state level, as well as there are tribal health departments and some cities like New York City and now newly Philadelphia that gather their PRAMS data. And this is done in partnership with the CDC. So staff in the CDC office federally typically help to coordinate this process to ensure that there is data comparability across states and across time. Almost all states participate. There's a small number that have historically not participated, like California, even though some, including California, do gather their own data that are comparable to PRAMS. They're just not collected by the CDC as part of the national data set. But generally, there are more than 40 to 45 states participating in a given year. So really great national coverage. This data set has been collected annually since 1987. So it's really the only national long-term data set that we have that is uniquely targeted to understanding the perinatal period. And in terms of how it operates, so the states carry out their own data collection. The CDC historically provides technical assistance, for example, with sample design, with assigning and calculating survey weights. And then they also harmonize the data at the end of each year and make it available. Or I should say, I should be speaking in the past tense, as you'll soon hear that a lot of this process has fallen apart. But typically, they harmonize that data and release it and make it available through applications to interested users. And so researchers or others, practitioners who are interested in using that data can request it from the CDC. They can also request it from a single state if they only need data from a single state. But the idea of having that centralized at the level of the CDC is to have a streamlined process to relieve the burden on states and data requesters for people who need information from more than one state. Pass it on to the next person.
Thank you, Dr. Hamad. Dr. Warren, you've spent many years leading state and national maternal and child health programs. Can you tell us why PRAMS is so important?
Well, thank you, first of all, for having me. And I will tell you, both in my previous life as a state Title V director and then in leading the Federal Maternal and Child Health Bureau at HRSA, I regularly look to the PRAMS data to guide the work that we were doing for mothers and infants. At the state level, for example, every 5 years, the states do comprehensive needs assessments to guide the work of their block grant and outline what their priorities should be and what action steps they should take. PRAMS data are essential in helping states to understand that landscape and to be able to guide that work. And at the federal level, we actually used PRAMS data as block grant performance measures. So all 50 states plus DC plus a number of the territories and freely associated states get the block grant. There are a number of performance and outcome measures that they report, and the data source for of those measures actually comes from PRAMS. So these are essential for guiding public health programs and practice. And this is really a unique data set in that we don't get these answers from other data sources. I think people, when they think of maternal and infant data, they think of birth certificates and death certificates. And while those data sources provide us with important and interesting data elements, they don't provide a complete picture of how moms and babies are doing in this country and where there are opportunities to improve. I will give you a very concrete example. Just a few weeks ago, I was preparing for a legislative testimony for a state that is focusing on improving infant health outcomes. And we were trying to talk about women's health across the life course and what happens in that year prior to pregnancy, and in particular, receipt of preventive care, like a well woman checkup. There's not a readily accessible data source outside of PRAMS to go to get that. So I had scoured multiple data sources, and I picked up the phone and called the state PRAMS director and was able to get that data in a matter of minutes. PRAMS is really vital to being able to paint a fulsome picture and really be able to understand where there are those opportunities for improvements. The other thing that I think is really important is that PRAMS gives us the opportunity to hear from individuals. We're not talking about administrative data sets, and to understand feelings and experiences. So, for example, experiences of discrimination during pregnancy, so vital, particularly as we think about the stark and persistent health inequities that plague this country. Being able to hear from individuals firsthand about those experiences is vital to then guide actions to make those outcomes better. And I would say then finally, PRAMS is a really important vehicle to help us keep our finger on the pulse of what's going on with mothers and infants. This data source, because this represents an annual data collection, can be customized to some extent to be able to respond to evolving issues. So if you look at the work that our colleagues at CDC did during the Zika virus work and response, if you look during the COVID-19 pandemic response, there was the ability to add additional questions to the PRAM survey to be able to understand what is the unique impact on pregnant women and infants, and how can we use that unique information to be able to guide the response for this specific population that may very well, in fact, be different from the rest of the population. I think we find ourselves in this time of maternal and infant health crisis in this country. In the 30 minutes that we're on this webinar today, one baby will die before reaching their first birthday. Between now and the same time tomorrow, two women will die, either during pregnancy or labor and delivery or in the first year postpartum. We are on this road to improvement. We are headed toward that destination, but without PRAMS, it's like we're driving in a car with a blind on, and we can't have the data that we need to be able to get to the journey, the destination that we're all on together in public health.
Thank you so much, Dr. Warren. As a PRAMS data user, I know why it's important, but those specific contexts about infant mortality and pregnancy-related mortality just really help drive home how important this data set is. And so the data set, unfortunately, is at risk. And I'm going to turn to Denice. I know you have been keeping an eagle eye on threats on public data. So based on your assessment, what are the risks that are facing PRAMS? And they are pretty stark.
They are. Thank you, Beth. So when we look at a data set's risk in the current environment, we look across 6 factors, and I'll just go down what we're seeing with PRAMS. And the first is related to policy. What we've seen here is that some of the question and response options on gender were removed due to one of those early executive orders around gender ideology. And what happened there is that the detail of some of the questions was reduced in order to comply with the executive order. And one example is the question about patients experiencing discrimination. The option to choose that you believe that you were being discriminated against because of gender was removed. So the collection's a little bit lighter than it was before. With regard to resources and staffing, I think this is where we've seen a lot of activity, and in particular, the most recent. The resources and staffing. Here we go. In April, the entire 17-member PRAMS team received a RIF notice and was placed on administrative leave. That was a pretty high-profile event that all of you have probably heard about. And unfortunately, many states do not have the necessary capacity to respond and process the data requests from researchers now that CDC isn't providing data. They don't have the staff. And even with state funding for 2025 data collection, it's a major loss to not have the assistance of that important CDC PRAMS team to compile, clean, weight, and prepare the data and maintain the data collection platform and establish standards. And then lastly, the burden with the dissolution of the PRAMS team, the burden we're really seeing is shifting to the states. Some states like Maine are planning ahead after funding ends this spring, but that's going to be piecemeal and will affect both the comprehensiveness of the data as well as the continuity. With regard to historical data availability, often what you see here are like clues on the website when you go to see the data. And the most recent fully published data was from 2022. We know that when those rifts occurred, the 2023 data was about ready to be released. But at this point, the data portal no longer works and you can't download any data. Instead, users have to contact all of the individual state and territorial program coordinators to access the data one state at a time, and then individually clean and harmonize the data sets themselves. So you can see that a lot of burden has shifted not only to the states, but also to the end users in order to turn these data into actionable insights. In terms of future data availability, as I mentioned, the 2023 data hasn't been published yet. In early 2025, the PRAMS website did say that the 2023 data was anticipated to be available by March of 2025. Obviously, that came and went. And then because the CDC team was placed on administrative leave before it could release the 2023 data, that we haven't seen the 2023 data. And the team was at that point ready to start on the 2024 data collection. So we are falling behind in terms of the continuity. And then in terms of data quality, what we're hearing across the board is concerns about accuracy, timeliness, gaps, and comparability because of that critical role that the CDC played at the center of all of this. There's widespread concern about obtaining accurate nationwide data in coming years, 24, 25, and 26. There's news reports about mixed responses on PRAM status across different state public health officials. So we may end up with good visibility on maternal and infant health in Maine, but maybe less so in Mississippi. And with potential gaps in surveillance, this could impact having timely and comparable data across the nation. And then lastly, I wanted to close with the statutory context. As I think has been mentioned, states are not required to participate in PRAMS. For example, California doesn't participate. But there is the PREMI Reauthorization Act of 2018 that assumes that PRAMS does exist at the federal level, compiling the data from states who are preparing it. And so, if you could go to the next slide, I just wanted to show you the language, the statutory context for this. And so PRAMS is explicitly mentioned in the PREMI Reauthorization Act, and in the context of continuing systems for the collection of maternal, infant, clinical, and biomedical information, to link with the pregnancy risk assessment monitoring system. And then there's this little caveat that says, to the extent practicable, which obviously weakens it a little bit. And so there's definitely statutory intent for the PRAMS collection to continue, but it isn't ironclad. And so just to close, in sum, the future of PRAMS remains uncertain. Its utility remains impacted by the loss of federal support. There are still major disruptions to data access, staffing, and centralized supports for states. And this has placed additional burdens on states to handle workload and navigate the ambiguity, as well as researchers who depend on these data. Back to you, Beth.
Thank you, Denice. So all of that paints a picture about how important PRAMS is, and the very serious risks facing our ability to access and use the data and track pregnancy-related issues and infant well-being. And so you are all here today to learn about what you can do. And Meghan, I'm going to turn to you. You always have excellent suggestions for how people can take action on data. So can you share some of your thoughts with the audience?
Yeah, for sure. So, once every 3 years, when an information collection like PRAMS is renewed at the federal level, we have the opportunity to weigh in and tell the federal government how important we think a data set is, and to tell them if we think any changes should be made. That time is now. So right now, CDC is renewing this data collection. They have opened a public comment period. And you as an individual in the public can go ahead and make a public comment on that data collection. I will say, as a former government employee, these public comments make a huge difference. We really wanted to know what the public thought, and we really took their opinions into consideration when we were making decisions about policy, about data collection, and about what felt like the best use of federal government resources. So I really hope you do take this chance to comment. Every public comment opportunity is a little bit different. So I just want to give you a couple of tips on sort of logistically how to public comment on this. You see the link here. There's a notice in the Federal Register talking about PRAMS. When you go to that Federal Register notice, it does give you directions on how to public comment. In this case, it will tell you to click on a link to go to regulations.gov. When you get to regulations.gov, you're going to enter the docket number that's in that Federal Register notice. I'm going to say it to you, but no need to remember it. You can just go into that Federal Register notice and it will tell you again that it's CDC 2025-0750. When you type in that number, you'll see a button to click to public comment, and that will take you to a public comment form where you can write in whatever you'd like to tell the federal government about this data set. Now, on content, I'll say any content is good content. Any comment is a good comment. If you only have time to go click this link and write in a single sentence that says, hey, PRAMS is important to me, and I hope that you continue to provide this program with the resources and staffing it needs to be successful, that's wonderful. If you'd like to write something more robust, that's a great thing to do as well. And again, it really is meaningful to the folks in the agencies who are reading these comments. That content might be anything from legal reasons why they must or should continue this program to explanation of why it's so important, like our guests explained here today. If you're a little bit shy about knowing what kind of content to include in your public comment, you're in luck. Our colleagues at the University of Pittsburgh on the next slide are running an actual public comment writing workshop in just a couple of days on this data collection in particular. They'll help participants walk through the process of writing a particularly effective public comment, although again, even a one sentence comment is great, and help you with finding sort of the information you need to write that comment well. Their workshop is on January 13th from 12 to 1. And it's a great, if you want to write something a little bit more robust, it's a great way to do that. Now, if we've whetted your appetite to to write public comments on other data collections that you might find interesting, dataindex-us tracks these open public comment periods, not just on PRAMS, but on just about anything that you might find of interest. Feel free to go check out dataindex.us, where you can see a bunch of opportunities to take action. And if you want to talk to some colleagues who you think might have interesting thoughts or ideas about how to engage with federal data policy, please join us at the Federal Data Forum, where you'll find lots of nerds like us coming together to talk about what's happening in federal data policy. So with that, I will toss it back to Beth.
Thank you so much, Megan. I love leaving people with concrete actions that they can take as opposed to just the sky is falling and that's all we have to say. So thank you for leaving us with hope and with actions. Unsurprisingly, with more than 300 participants on the call, we have quite a few questions. We are for sure not going to be able to get to all of them today, but we will answer as many as we can in the remaining 8 minutes. And we will try to answer of the remains that we don't get to, we will try to answer as many as we can with our follow-up materials. So one of the questions that came in advance of the webinar is from someone who says, our state has strict rules about lobbying, which extends into advocating for critical programs that assist the public. Are there any tips that you have to avoid the appearance of quote unquote lobbying and strictly adhering to factual statements? So Megan, I'm thinking you might have some insight on this one.
Yeah, sure thing. I'll say, every state's rules are a little bit different, and it's important for you to learn and understand what the rules are in your state. But in most states, we find that people are permitted to engage in this kind of public comment on regulatory action or federal data collections in their individual capacity, even if they can't comment as in their professional capacity. So that might be one way to make sure that you're staying in alignment with your state's ethics rules is to engage with this in your personal capacity. And again, I'll say as a former government employee, we saw a lot of instances where even federal government employees were commenting on in their individual capacity on some of these changes as they were being made. So I think that's probably the easiest way to stay in alignment. Though, as an attorney, I feel it's important to say you should make sure that you're talking with your colleagues about the particular requirements in your own state.
Thank you. There are a couple of questions that I'm going to kind of lump together that are related to those discrimination questions. One of them was someone wrote in with a clarification. The question on sex was not technically removed, but the gender was removed. So we think of that as removing the gender question. That might just be a nuance in interpretation. So there is still a question on whether or not someone was discriminated, feels that they were discriminated on based on their sex, but not an opportunity to respond if you think it was based on your gender. And there were related questions relevant to race and ethnicity and disability. And early in the spring of 25, we thought that those questions may have been removed. My review in the fall of 2025 suggests that they probably have not. We will fact check that with the materials that we send back, but to the best of my understanding, questions related to disability and questions related to race and particularly discrimination related to those factors still exist on the survey, but we will fact check that and include it with our response. There was another question, Megan, that came in, and now I've lost it. Oh, who reads the comments? Which I thought was just a great general question. Who reads the comments and like what agencies read these things that we're all sending?
Yeah, fantastic. So usually there are staff in the receiving agency, so in this case in the CDC, who read every single word of every single comment and really engage with them and then create a summary that goes to other folks within the agency and often to OMB. So there's usually like one or a small group of people who are reading really every single word, and then quite a few other folks really get that summary document.
Yeah, I think we probably have time for. Oh, there are a couple of questions around data preservation. And I'm going to take a crack at trying to answer this. And then Denice, you can jump in if you have anything you want to add. One of them was, can we talk about preserving national and or state PRAMS data? And one, a related question basically said, is there any way to take the data and move it out of the United States to Canada or Europe? And I would say that yes, there's sort of two ways to answer that. Publicly available data, so not the individual survey responses. There are projects like the Data Rescue Project that are doing backup copies of those things to make sure that they continue to be available. The individual survey record microdata that may have identifying information on it, I do not think that there's any way to, nor would it be secure or sort of private. It would violate privacy concerns from my perspective to sort of remove the raw data. But there are efforts to make sure that the existing data are archived in multiple places. I think the challenge is with something like the 2023 data where CDC hasn't released it. If you wanted to get that, you've got to go state by state and try to compile it. Denice, was there
And
anything that you
I'll
wanted to add?
I'll just add there are models in other domains like crime data, for example, where the real-time crime index harvests data directly from law enforcement agencies and produces an estimate of crime that is complementary to the official data coming out of the FBI. Similarly, you saw a similar thing with the COVID tracking project, where Hopkins and others harvested the data from public health institutes until the CDC kicked in. So there might be some stopgap measures to do that harvesting across the states.
Thank you.
Can I,
And then
can,
Rita, I have one more question for you, and it's related to you had a comment in our discussions earlier about this data request is asking for about state data collection and not necessarily restoring the staffing. Do you want to speak to that?
Right. So I think everyone should definitely, go online and put in comments for this federal request for comments. But it is important to keep in mind that this is primarily funding continued data collection at the state level. It doesn't require that the CDC staff be reinstated, and that is going to be a continued barrier to access to the data at the national level, and for the CDC to provide that technical assistance to states. So, to address sort of a couple of questions that have come up, I think it's definitely the case that we need to continue to advocate for the CDC to bring back those staffers or replace them if they don't want to come back, but that we need that expertise and staffing at the national level. And to sort of add the question, to address the question, one of them was about what can philanthropy do? I think there is an opportunity here for philanthropy organizations to perhaps help fund so instead of every single researcher going out and requesting data on their own, if there's some states that are willing to have sort of a more centralized repository, something along the lines of ICPSR or the Data Rescue Project, to reduce their own burden and the burden on data requesters, I think there's an opportunity there for collaboration between foundations, philanthropic foundations, and researchers to try to keep this moving forward by the time, hopefully, the CDC office is restored.
And I think that is a really fantastic place to end and excellent timing. So I want to take a moment to thank all of our panelists for sharing their time and expertise with us today. Even as someone who's worked with this data before, I learned new things today. I want to thank all of you who attended for caring deeply about public data. And as a reminder, in case you missed any of the links that we shared, we'll be sharing slides, the list of actions, and the webinar recording, and there were lots of questions, as many of those questions as we can get answered. So now go submit those comments. Thank you so much.